तुमको देख के ऐसा लगा कि शादी.
Let's start. What, Anjali Didi?
Okay, let's start studying.
Okay, let's start. So we left in page number 19 yesterday. So we are in 20. So in general, these poses are safe in pregnancy. So during pregnancy, you can make these asanas to do. Okay. So no concern. If like you are giving the regular class also and some people comes, okay, and then they want to do with you also, these asana you can give them like butterfly stretch, cat and cow, cobra in the first trimester. So in the first trimester, she can do cobra. Okay. If you feel comfortable doing the down face pose. Okay. So if she feels comfortable, okay, you can give her cobra. Like don't give like too much stress with the bent hand or with the like, bent elbow on the ground. She can do the first level of cobra. Side angle pose she can do during pregnancy. Standing forward bend with the modification. Okay, it's like she cannot go all the way down, but with the wall support, right? With 90-degree, her back is in 90 degrees, she can do. And triangle pose with the chair modification, because triangle pose is the side bend. So she can do with the chair, like she should not go all the way to the ground. Okay, with the chair modification, with a block, she can give, she can do these asana. These asana are general asana. Okay. 1 minute. Okay. So avoiding poses. What she should avoid? Back bend, she should avoid. Balancing pose on one leg. Okay. So Brikshasana, I already removed because it activates the chakra. Okay. So modified Brikshasana, like Brikshasana's modification, like leg in half lotus. That is also, it activates the, what is that? Marma point. So Brikshasana, I already removed it. So she cannot do any balancing poses on one leg without support. Okay. With support, she can do. Camel. Okay. No camel. Handstand, headstand, upward bow. So these are the completely avoiding asanas. So week wise, I will give you the asana list. It will make you easy when you teach. Ask her the week and then teach accordingly. Make the sequence like some weeks we'll have like 10 asanas. In some week we'll have like 20 asana also. So according to that, we'll make a sequence. Okay, starting from the standing, sitting. Okay, then it will be easy for you. So I will give the complete sequence. Okay, don't worry for the weekly asana. Now let's move to the second trimester. Exercise during the second trimester of pregnancy can be very important in keeping up your energy, her energy level, and for helping her to sleep well during the night time. So she should sleep also. Once she will sleep, okay, then she will get rest. Then tomorrow morning she will get energized, right? The key to exercise during pregnancy is to take it slow and steady. She should warm up. Okay, little bit warm up is needed, because without warm up again, we cannot give any asana. Okay, exercise, and stop if she feels short of breath or she feels pain, and slow down before you come to a complete stop. So we cannot say, okay, let's do Surya Namaskar or Chandra Namaskar, let's do this sequence, and then come and lie down. So it should not be like peak and down. Okay, so you should slowly go, slowly come down. It should be like a mountain. It is always wise to get her healthcare provider's stamp. Okay, so if doctor said don't do asana to her, then if doctors like says complete bed rest, then we cannot do anything. Okay, so if she comes with a stamp like, okay, doctor has told to do yoga, okay, then we can teach her. Approval before we begin an exercise program. Or exercise over here is the complete form of like all the yogic postures. Is like pranayam, yogic asana, pranayama, okay, meditation, relaxation, everything, including If they want to go for running, they want to go for swimming, so exercise or is written over here. Or if she wants to change, she wants to change her program while she is pregnant, so she can decide what she wants to do. So this is the question from the pregnant woman: how hard I should exercise? Okay, how hard she should work on when she exercises. Okay, when you, so this note is for the teachers also, this note is for the pregnant ladies also. Okay, that's why it is written you over here, so don't get confusion. When you exercise, make sure you stay below 60% of your maximum heart rate. So if like your heart rate is beating so fast, then it is not a good exercise. So 60% below the maximum heart rate. So we cannot make her heart rate 100% maximum. Okay, for most women, it means you should maintain your heart rate less than 140 beats per minute. So it should be less than 140 beats minute. It is the average, okay, medical counting. Keeping your heart, okay, rate in the good range is important when you exercise, because your body moves more blood to your muscles and skins and may move less to your uterus. Right now, your focus is your uterus. You want to move the blood over there. Okay, but when your heartbeat is increasing, okay, then blood is moving towards the muscles. Okay, and now we want movement of blood towards the uterus. If exercise is too strenuous, take a risk less. There is a risk that less oxygen will reach to the baby, and once oxygen is less in the baby, then there is a chance of having blue color baby. Okay, that means that baby has more carbon dioxide in the body than oxygen. If you stay below 60% of your maximum heart rate, you don't need to worry about harming your baby when you exercise. Remember to avoid overheating. So heating inside causes miscarriage again. So one of the main reason of miscarriage is extra heat. So we ask the planning ladies also to avoid Vastrika Pranayam, Surya Vedi Pranayam, Kapalavati, Agnisara from the planning phase. 3 months before she should stop, because heat is the very worst enemy. It causes miscarriage. Okay, so remember to avoid overheating and keep yourself hydrated during any exercises you are doing. What if I have been instructed not to exercise during the pregnancy? Okay, so with all this talk about the benefit of exercise, there is also little harm in not exercising. So there will be, you will not get the benefit. Whatever strength you need in your pelvic region, in your spine, you will not get by doing this exercise. But if doctor is saying don't do, then don't do asana. So the alternative are, you can do mudra, you can do pranayama, you can do yoga nidra, you can do meditation, right? You can do whatever doctor says you can do. Women who choose not to exercise also have healthy babies. So it's all about the mind. If your mind is totally positive, okay, then you will get the healthy baby. If you are not taking any stress, then you get the healthy baby. So don't worry if your doctor has suggested that you not exercise. So for some ladies, doctor will say totally bed rest. Okay, complete bed rest. For some, they say leave your job. For some, they will say you can just walk around, right? You can just do small things at your home. So what is the condition of the mother? Okay, to be mother, she is actually mother. She has already conceived. That means she is already mother. Okay. It is recommended that you abstain from exercising if you have a variety of pregnancy-related condition. For example, placenta previa, okay, toxemia, preeclampsia, okay, or intrauterine growth retardation. So in this case, okay, So these are all the medical term. We'll study these a little bit in during the high risk pregnancy. So placenta previa mean the placenta is not in the exact right position. Okay, so placenta, I will search Google and then I will say you the exact meaning.
Placenta previa.
So placenta previa means
Placenta is not in the right place.
yeah, so it is little bit down, like it is nearby the cervix, we can say. Okay, not like the in implantation where it should be implanted, the fetus should be implanted, it did not implanted that place, it came little down. Okay, toxemia means a potentially dangerous pregnancy complicated characterized by high blood pressure. So when she get pregnant, blood pressure should go down. This time her blood pressure is increasing, that is toxemia. Preeclampsia. So preeclampsia means the potentially dangerous pregnancy complication characterized by, this is also the synonym of toxemia. Okay, this is also high blood pressure. Intrauterine growth retardation or restriction, it means a condition in which the baby doesn't grow to normal weight during the pregnancy. Okay, so in this case, doctor will say you have to do complete bed rest or you should not do asana practices. Okay, so for this time we have Garbha Sadhana again. We have all this color therapy. We have all these stotra chanting, right? So I'm there.
Every problem has solution.
Yes, I'm there. I'm always there. I'm already a Garbha Sadhana teacher, right? So tell me what is the is the problem, and then I will go with my instruction with her.
Okay.
So if you have a history of spontaneous abortions or a sufficient or insufficient cervix, okay, it may also be recommended that not to exercise. So she's having abortion in the previous time and she has the history of miscarriage also, okay, that time, and insufficient cervix, the cervix is not in the good size, okay, cervix is small, that time also exercise are prohibited. The beneficial effect of protecting your baby by not exercising outweighs any good, okay, done by few laps in the pool. So don't worry, okay. So we can have a healthy baby by other practices also. Asana are not only the solution for the healthy pregnancy. Okay, so there are so many alternatives.
As well as for normal yoga also, if one cannot do asanas, pranayam, mudra, and
Yeah.
yoga nidra helps.
Yeah, pranayama they can do except the heating pranayama. I already told you. Don't let them do Bhastrika pranayam. Okay.
And
Don't
Kapalbhati,
yeah.
Bhastrika,
Don't ask
Surya
them to
Bhedi
hold.
also.
Yeah, no heating pranayam, no Surya Vedi,
Oh.
Alavati. She can do Nadi Suddhi all the time. She can do Sitali
सबसे
Sitkari.
अच्छा नाड़ी शोधन without attention.
Yes, Nadi Suddhi without holding. Breathe in from the left, breathe out from the right, breathe in from the right, breathe out from the left. This is the solution for everything. She can do Sitali Sitkari if the season is not cold and she is not suffering from cold and cough, right? Or she is not the asthmatic person or anything. She can do Brahmari all the time. Okay, she can do Ujjayi.
But some people, some ladies have low blood pressure, then cannot do Brahmari because of Brahmari, I think blood pressure lowered down.
Due to Brahmari, blood pressure doesn't go that down, I think. Brahmari you can give like a few round, 5 round, 6 round you can give. Not
Right.
like you should not give like do for 30 minutes or 40 minutes. Don't do that. 5,
But
6 round you can.
when we were studying from Sri University, no, My English was not that much good, but I tried because I want to improve my English. You know, so please don't laugh at my English.
No. You are doing.
When we were studying with Rishi University, no,
Uh,
you were also there, no?
yeah, I was.
Pratibha ma'am was there. And
Yes.
she was telling about Bhramari
Uh,
that if a person have high blood pressure, if he does Bhramari every day,
uh,
3 times, है ना?
uh,
21 times, like मतलब ज्यादा करना है उनको.
yes.
Then they उसके बाद अगर वो देखेंगे तो they will find that their blood pressure has lowered down.
Okay.
What does this mean then?
So the thing is, they are doing 21 times, right? 3 times a day. Bhramari actually heals everything, Didi. Bhramari is a healing pranayama. Okay, it cools down everything. So it reduces the heartbeat also. Okay, so high blood pressure, people are getting benefit by doing like 21 times. But during pregnancy, to make her mind cool, okay, she can do for 4 to 5 rounds. Okay, clear? So
Yes.
for 4 to 5 round, if you'll do 4 to 5 round in one day, it will not make her like, you know. Bhramari is a very safe pranayam during pregnancy. Okay. Okay, so what types of exercise are appropriate during the second trimester of the pregnancy? Okay, so aerobic activities such as running, if she is healthy, okay, totally doctor has told you can do. She can do running, she can do swimming, relaxation technique and strengthening training, okay, are all appropriate during the second trimester of her pregnancy as long as you are aware of your limit and follow simple guidelines for safety. Month by month guidelines are given as below. Okay, so in the 4th month, if she wants to do the weight training like weightlifting in the gym, okay, she can do it, but the modification is she should not do in standing position, she should sit and do. Okay, she should modify her practice if she is doing from the very beginning. Okay, it's not like, okay, you are in 4th month, now you go and lift the weight. It is not like that. As you begin your second trimester, okay, this month, your total blood volume has increased and the placenta and baby are growing. When you stand, blood can pull your legs, okay, causing you to become lightheaded or dizziness may occur. For this reason, it is safer to do weight training exercise while seated. So if you are a continuous weight training person, if you are new, okay, don't go. During pregnancy, you know, pregnancy is a very beautiful period in which you will learn so many things, but you will do only what you know in this practice. Okay, so you don't, you should not even teach new pose. If she has not done that asana till this time, don't teach that asana. Whatever she has done already, she should do that. Okay, so pregnancy is not the time for learning new asanas or new types of exercises. She will learn so many things, okay, but she will do the things which she is familiar with. You got it, right?
Yeah.
If she is a weight training person, she can do. If she is not, you cannot say, okay, now you are fourth month, you start lifting the weight by sitting. No, don't say that. Jogging and running. If you are a runner, okay, if she is a runner from the very beginning, you can safely continue to run in moderation, not like before. During your second trimester, your uterus gets larger, causing your center of gravity to shift, which makes you more prone to losing the balance. So you should not run like before. You should be very cautious. You should run moderately. Okay, therefore pay close attention to where you are running and be safe to run on flat ground with as few obstacles as possible. So if you are running in a very, you know, a rock place, change the place, start running in a soft place. Okay.
This is very interesting.
Yes.
I thought कि इसमें रन तो मैंने सोचा ही नहीं कि मैं रनिंग कर सकते हैं, मतलब जो पहले करता हुआ आ रहा है वो
हाँ
कर सकता है.
हाँ, she can do. If she is doing from the very beginning, she can do, but she has to modify also.
Yeah.
Like if she is running on her 100% capacity, if she can run 1.5 kilometer, her capacity is 1.5 kilometer in 10 minutes, then now she has to come down. So she should even come below 1 kilometer.
Mm.
Okay. So for yogic practices, especially asanas, okay, as you slowly get bigger and your joints loosen because of the relaxing hormone, your balance may be affected, putting you at risk of injury. Pay attention to your body and only do as much exercise as it is comfortable. Your breathing should stay smooth. Okay, so once the breathing rhythm changes, you start breathing in, breathing out a little bit faster, then stop it. If you find you cannot breathe in, breathe out easily, okay, and smoothly during position, during asanas, think about shifting into an easier version of this position. Okay, so modification right now, stretching or extending less or staying closer to the floor. Okay, so in the second trimester, all this support, wall support, okay, chair support, everything are needed. Ball, ring, whatever makes her easy, all these modification are blocks we should give, bolster, cushion, so that she can feel more comfortable in the same asana. Swimming, if you are a swimmer, if she knows swimming, you should be able to continue swimming into your second trimester without any difficulty. If you are new to swimming, okay, so if you are new to swimming and you want to learn, okay, you want to learn, then you have to do very slowly. Okay, start slowly by swimming gently for a short period of time, taking caution not to overexert yourself and working up to longer workout. So if you want to learn swimming also, you should start from the baby step. You cannot like, okay, now I'm in second trimester, I want to learn swimming during my pregnancy, I will go and run, swim like this and that. No, don't do that. If you can postpone your swimming practice after the delivery, okay, that is good. But if you want to do right now, then take a very slow baby steps in the 4th month. Okay, now we are moving to the 5th month. As your belly gets bigger, you may find that your center of gravity has shifted, okay, and you are not as agile as you once were. So now the body is moving backside. You have that experience, right? Now stomach is coming, spine is like tilting, like the arch is getting more and more. That is what it is. The central of gravity. Once we are standing right now, so we are in a straight line, right? Slowly we are not in the straight line. Now center of gravity is changing. Okay. So compensate by becoming more careful when you step. That means when you are walking, you should be careful from this time. At this time, you will also want to stop exercise that require you lie on your back. So you can, if you want to stop, okay, the supine position things, okay, like for like very short time you can do, but if you want to stop, you can stop. Okay, supine position practices. As the uterus increases in size, lying in your back can put pressure on the inferior vena cava. Okay, the large vein that runs vertically the length of your abdomen and is responsible for the returning blood to the heart. So if like this inferior vena cava is not working properly, the woman will suffer from the varicose vein. To save yourself from the varicose vein during the pregnancy, then you should completely stop. Okay, completely stop lying down for like you can lie down for like 10 second, 5 second. Okay. But not even 1 minute. Okay. As you progress in pregnancy, your body produces a hormone called relaxin. We already know it. It will come again and again. Okay. So that it will be fixed in your mind also, which is responsible for loosening joint in preparation for the growing baby, labor, and delivery. So what is the function of relaxin? Relaxin hormone is loosening the joint. Okay. Joints are getting loosened. Okay. But the relaxing hormone is, working on the whole body. So the purpose of relaxin is to loose the joints which are in the pelvic floor. Okay, so that she can give baby normally. But relaxin is working in every point, in your hands, in your legs, okay, in your neck, everywhere. As your joint become looser, you are at more risk for sprain and strains. Okay, so there is more chance for like ligament injury, tendon injury. Okay, so you should be very careful. You can split, but be careful. Don't split. Okay. Your increased weight and the change in your center of gravity may cause you to lose your balance. Okay. Also putting you at greater risk for injury. So you can fall down. You should be balanced all the time. Okay. You should take care either you are getting balance or not. For this reason, it is better to avoid exercise that involve extreme stress. Don't do stretches, extreme stress, or those high impact activities like aerobics, don't do, and running, like full running, don't do. That puts a lot of stress on your joint and put you at the risk for falls, like you can fall down. Okay, because of the center of gravity. Okay, so for the yogic practices, as your pregnancy progresses and has a larger impact on your activity, it might be wise to consider joining a yoga class for pregnant women. Okay, or buying a book of yoga poses that are safe for pregnant women. If you are already a yoga teacher or if you are already a yoga practitioner, you can get a book and start what are the safe pose. Okay, for you, I will give you a complete sequence for every week. This week this week this, like we'll have a good sequence from week 12, 13, 14, 15 up to 40. I will give you a very good sequence, so don't worry about the asanas. Okay, walking, as your weight changes because of the change in your body shape. Okay, be sure for focus on your posture when walking and keep your hips tucked under to prevent arching. Okay, so the arch is increasing, right? Like this. So tuck your belly, like a tailbone in little bit. Okay, hip tucked, okay, little inside, so that you prevent the arching of your back due to the increasing amount of weight you are carrying in the front. When you feel out of breath, slow down or stop and rest. Okay, during walking also. Now running is completely over. 4th week, running is done. Okay, now you are in the walking position, walking stage. You should be huffing. You shouldn't be huffing and puffing like. You should not do like that after walking. Okay, you should not get tired. Swimming, if you are a swimmer, you should be able to continue swimming in your 5th month also without any difficulty. If you are new to swimming, again start slowly. Okay. I recommend not to start. Okay. But if you want to start, if you are like, this is my swimming time, something like that, I want to learn anyway, then again, baby step. For a short period of time, taking caution not to overexert yourself and working up for the longer workout. Now, during the 6th month, your blood volume increases by 40% during pregnancy, and your cardiac output, heart rate times amount of blood pump per beat increases by 30 to 40%. That means your heart has to work 30 to 40% more. Heart is working more. During exercise, your heart rate increases even more. Okay, so heart is already working more, and if you exercise more and more, then your heart will be in problem. don't make your heart tired. Okay, by heart you should always be young. Don't make your heart old by asking to work more. Okay, although research show that women who exercise regularly have no increased risk of problem with their pregnancy, the key is still moderation. Okay, so moderate. Now don't think about yourself. Think the baby.
Everything should be done in moderation.
Don't push yourself too hard. So this is not the time to push. Okay, this is not the time for tapas. Be yourself hydrated and cool. So she can continue the weightlifting. Okay, but you should be more cautious. Okay. In the 6 months, you may want to decrease the duration or frequency of your workout depending on how you are feeling. So follow the intuition. So pregnant woman gets the best intuition. So that type of intuition doesn't come on other period as much as during the pregnancy time. So catch the intuition. Okay, what are you feeling? Okay, if you use free weight, be very careful to avoid blunt injury to your abdomen from dropping the weight. Now, for the asanas practice, now that you are at the end of your second trimester, this is the 6th month, you may need extra balance support when doing the standing position. Wall, chair, all these are needed. Avoid poses that stress the abdominal muscles. Now you cannot do anything for your abdomen, like stretching for your.
Like Marjorie Asana?
Huh?
Like Marjorie Asana?
I will give you a list, like, in which week we can do what asana. So I cannot say like up to which, right now I don't remember which week to which week Marjorie asana is safe. Okay, so it will come. Marjorie asana, actually abdominal muscles, they don't stress that much. Like you are going up, down, right? Like the cat pose. It's not a problem. I heard you were saying Marjorie asana, and in my mind it was going Marichaya asana. That's why I told.
Marjorie.
Sorry. So Marjorie asana is safe till labor also. You can do during the labor also. Okay. That require you to lie on your back. So lying down, you should not do it during your 6th month. Okay. Bend from your hips. Okay. So when you are bending forward, bending from the hips, if you feel discomfort, stop and reevaluate if there is an easier way to do the same position. So follow your body's language. So don't push any pregnant woman. Don't push. If she comes to asana class and she says, no, today I will not do any asana, then okay, let's talk. In between, when you are talking, when she says, no, we can do 10 poses today. Okay, let's do. Or she says, I can, like, we can do for 10 minutes. Okay. Okay, so you should be, changing with her time. So whatever she feels. Now, let's move to the 3rd trimester. The 3rd trimester lasts from week 28 to the birth of the baby. This may be an exciting and stressful time. Okay, exciting, new person is coming, and stressful. What gonna be do? I do. Baby will be like father or mother, like this simple thing. What name I should give? So many small things also give her so much stress. Okay, but she should not take stress. Okay, for her and her partner also, new issues may emerge. You may wonder, how will be labor and delivery go? Will my baby be healthy, right? Will I be a good parent? Should I breastfeed or not? Okay, am I ready for this? So many things come in the mind. These may be similar to the fear you had when you first discover you're pregnant. Okay, so if the pregnancy is by chance, okay, so what Garbha Sanskar says, according to our culture, Eastern culture, what Garbha Sanskar says, baby should be by choice, not by chance. Nowadays we don't know, right? Baby
Mm.
comes by chance. Actually, I'm also baby by chance. My father and mother, they were not like, expecting me. I came. So during the if the pregnancy is by chance, okay, that time you will have the same kind of fear, like is it like if you already have children before, like isn't it extra or something, like it may come in your mind also. So you may be the similar fear when you first discovered you are pregnant.
बट मतलब पहले तो वही होता था ना, मतलब कोई प्लान करके तो करते नहीं थे.
Didi, the thing is, this knowledge was lost in between. The Garbha Sanskara knowledge was lost in between. That's why it is like by chance, right? But the thing is,
मतलब ऐसे प्लानिंग कहाँ करते थे. कोई
नहीं
plan-
करते थे. Knowledge बीच में खो गया था. It was lost in between.
क्योंकि गर्भ
But
संस्कार तो बहुत
हाँ,
पुराने हैं.
yes. But the thing, हाँ, but the thing,
गर्भोपनिषद है तो मतलब
हाँ,
बहुत पुराना है.
yeah, it is very like Ayurveda is full of this.
हाँ.
Garbhopanishad is there.
हम्म.
Okay. So these thoughts are normal. It is okay to be little scared. It is okay. But whatever you are doing, mantra chanting, pranayama, yogic practices, whatever practices you are doing, they are removing your stress or they are minimizing your stress also. The important thing is that you learn as much as you can, okay, about what you can expect during these last few months of pregnancy, during delivery, and after the baby is born also. This area covers many of the concern women and their partner have during the third trimester. You will learn about the office visit and screening test you should have during these months, okay, along with the warning signs of complication you should watch for. Okay, this area also covers some of the physical changes, okay, common in the last months of pregnancy, and ways you can relieve these symptoms and keep yourself healthy through diet and exercise. Like some women, they start like pregnancy diabetes this time, right? Some people will be too much weight will be too much, for some it will be too less weight, okay, weight gain. So there are different types of new problem will come this time. So you should manage, okay, that time you should manage that problem. If you are concerned about a possible symptom of complication of pregnancy, talk to your doctor or the healthcare provider. So if you are following with the doctor, then go for the doctor. Like in some rural areas, still doctor, they don't go, right? They have to depend upon nurse, right? So healthcare provider is the nurse or people who work under the doctor. Concern and tips during the third trimester. Okay, so can I travel? This is the question. Okay, traveling creates additional concern if you are pregnant. You have an increased risk of some medical problems. For example, increasing blood clot formation because of prolonged sitting during the travel. If you are sitting in the same seat for a long time, okay. Exposure to infections that could lead to miscarriage or serious illness. Unexpected miscarriage or pregnancy complication while away from the home. So ask yourself, should I travel or not? Okay, is it good for me, or like see the benefit and advantage and disadvantage of the travel. Okay, so actually pregnancy and like giving birth to a baby is not about not about you, it is about the baby coming. So think about the baby who is coming. Avoid long car trips or aeroplane flight if possible. If you must travel, stretch your legs and walk around at least every hour or two. Your doctor will generally permit you to travel by air until 32 to 34 weeks. So after 34 weeks, again, you will not even get the ticket also, unless you are at the, yes, at the high risk for premature labor. After that time, most airline may not let you to board, okay? board the flight if you appear obviously pregnant because of the possibility of unexpected delivery on the plane. Because once you give birth to the baby in the plane, then that plane like that is has the lifelong flight ticket for free. If you will be away from home for a long time, your doctor may recommend a local obstetrician, okay, who take care during your pregnancy, where you are visiting for you to contact. Be sure to take a copy of your prenatal records with you. For foreign travel, check with the Centers of Disease Control and Prevention for recommended vaccination or preventive medication for the area you are visiting. So avoid drinking unpurified water, unpasteurized milk, and inadequately cooked meat or vegetable. So we are vegetarian, okay, but everybody is not vegetarian. So if like a pregnant woman is non-vegetarian, you cannot say you should be vegetarian because you came to yoga class or something like that. Okay, so whatever she is eating, let her eat. Don't don't say eat this, eat that, like you should be vegetarian because you are in the, like yoga doesn't have any restrictions. Okay, until the time you want to eat, you eat. Okay. What should I do if the baby stops moving? Okay, movement is an important sign that the fetus is doing well. If your pregnancy progresses and your fetus gets larger and larger, the type of movement can change. Instead of your fetus punching you or doing flips, okay, the baby may roll more or stick an arm or leg out. Pay attention to this movement also. So movement can change, so go with the change. If your fetus is not moving as much as normal, keep track of its movement, eat a meal, and then lie down on your left side. Okay, if the fetus does not move for 10 times in the next 2 hours, you should call your provider, you should go to the hospital. Okay, there are many ways to count fetal movement. Ask your doctor provider, and she wants you to count also. So doctor will tell you like how to count. Okay, if the fetus is not moving, your doctor will order a non-stress test, okay, a contraction stress test or a biophysical profile, BPP. So these are all the medical terms. Okay, don't think like I'm your yoga teacher, okay, and I'm your doctor. No, we cannot work as a doctor. Okay, so doctor has their own work to do. We are just helping the lady, okay, to have a healthy pregnancy, healthy delivery, and stress-free pregnancy, a happy pregnancy. That's why we are prenatal and postnatal yoga teacher. So don't go after like your doctor this, why she is saying this. No, she should follow the doctor's advice. Okay, we are just like if like doctor is doing her 100% job, okay, we are also doing our 100% job. But if we consider like in one box, like we are doing 20% and the doctor is doing 80%. Okay, clear?
Yeah.
Okay, so our seat belt, should I wear seat belt or not? She should wear seat belt. Okay, seat belt doesn't harm her. Lap and the shoulder belt should be worn all the time when riding in a motor vehicle. Okay, particularly in the front seat. So in India, we can say if she's in the front seat, but in foreign countries, in the back seat also. Being an unrestrained passenger during a major automobile accident is dangerous, whether you are pregnant or not. So all the time, pregnancy is not excuse for seat belt. Okay, she should wear the seat belt. Seat belt will not harm anything for her baby. Okay, so I will stop over here. It's already 9 o'clock. So from page number 40, we'll start tomorrow. Sorry, next week.
Okay, thank you.
Thank you. Thank you so much.